Good afternoon, everyone. We're just letting everyone into the session. Welcome. We've got quite a few people logging on now. Might take a minute while they all come on in. As everyone does that, I'll introduce myself. But first, I'd like to acknowledge the traditional owners of the land on which we're conducting this session today, the Yagara and Turrbal people. Pay my respects to their elders past and present, and pay my respects to their children who will be our elders in the future. I'd also like to pay my respects to the Yugambeh people on whose land I live and raise my family, and the Drumbal people on whose land I was born and raised, and pay my respects to them. My name is Stacey De Calma. I work here at QUT as a Sector Capacity and Quality Officer. And my role here really involves designing, coordinating lots of different activities and resources and different supports to ensure that the social services sector can provide the best services that they can. And part of that coordination of activities and support is the COVID learning exchanges, which this session is a part of that series. It's a series where we ask ourselves about the learnings that we've really come to glean from the pandemic. And we've had a variety of different focus topics for that. Today, we are focusing on domestic and family violence, and we have got three really well-respected speakers on the topic who are generously sharing their expertise and observations of the last 18 months, really, of what the sector has experienced, not only service users, but also the workforce too. So I'm going to introduce them. I will introduce each of them individually because they all deserve their own real acknowledgement. They've got a lot of years of experience and a wealth of information amongst them all. So I'd like to just mention that the chat function down the bottom, we have a question and answer box and a chat function. If you've got any technical difficulties, just use the chat function to let us know, and we'll do our best to address those, any challenges you might have. As we go along, we will hear from each of the three speakers, but we'll have some questions and answers time at the end of the session. So we welcome any questions being submitted via that Q&A function. If you have any troubles with it, let us know, but submit them there. We'll hear from all of our speakers, and if through their speaking they don't answer the questions, we will come back to them and do our best to get through all of them by the end. Firstly, we're going to hear from Beck O'Connor, who is coming to us from DV Connect. Now, Beck is going to provide quite a broad lens to the issue that we're focusing on today, and her role at DV Connect. Beck, you've got such an impressive bio, so I apologise for reading from paper, but I can't fit it all in my head. Beck is the CEO for DV Connect, Queensland's statewide domestic violence 24/7 crisis response service, sexual assault helpline and specialist counselling partner for 1-800-RESPECT. Beck is deeply passionate about ensuring the safety, choices and dignity of people impacted by violence, and that their diverse life experiences are acknowledged and respected. As an inclusive queer feminist, Beck has dedicated her professional career to social justice, championing equality and self-determination through her work in adult, child and youth mental health in rural and remote areas, specialised domestic and family violence support and advocacy, women's health, child protection, LGBTQ+ health and wellbeing, family counselling and mediation services. Beck has particular expertise in the design and delivery of complex clinical services in a virtual environment, which is really such a valuable perspective that we're going to learn from today. Beck is also the Vice President of the LGBTQ Domestic Violence Awareness Foundation, on the National Sector Advisory Committee for 1-800-RESPECT, Stopping Gender Violence and Advisory Board for the QUT Centre for Justice, and a member of the Culturally and Linguistically Diverse Domestic and Family Violence Prevention Roundtable Advisory Group for the Queensland State Government. Now, Beck, the United Nations have called the domestic and family violence that we're seeing the shadow pandemic. What have your observations been during the pandemic?
Oh, wow. Look, first off, though, I would like to acknowledge that I am joining you on the lands of the Turrbal and the Yagara people, and I would like to pay my respects to elders past, present and emerging. So the last 18 months, to be a bit real for a moment, I think we can agree has all been incredibly full on. None of us could have possibly predicted the magnitude of events that have occurred. And there's been no rule book or leadership guide on how we're supposed to go about all of this, or what a world in lockdown was going to mean for women and children and our staff. So I'm completely comfortable in admitting that it's been a bit terrifying and overwhelming at times. So COVID-19 had seen day-to-day life altered in a way we've never experienced before. Whilst it was absolutely necessary from a public health perspective to lock down and restrict movement, there were many unintended and negative consequences to this, particularly for those experiencing domestic and family violence. Restrictions on leaving the family home in an effort to keep people well also limited the level of scrutiny that was happening inside the home, particularly for the safety and well-being of children. There was an enormous pressure on families, particularly in homes where violence already existed, who many then experienced sudden financial hardship and job loss, greater physical and psychological health risks, increased alcohol and drug consumption or impacts of withdrawal, and prolonged isolation. So this unique combination of factors made domestic and family violence incidents more frequent, more severe, and more dangerous, and provided an unchecked opportunity for increased surveillance and intensified coercive control for a person using violence. So whilst isolation is not an uncommon tactic of perpetrators of violence, whole communities in lockdown meant reduced access to, critically, to workplaces, extended family, friends, community supports, and contact with safe public places like schools and shopping centres. This disrupted a vital lifeline to those living with domestic abuse and made it far more difficult, if not impossible, for victims to get help or to escape. So from the perspective of DV Connect, on average, leading up to and throughout COVID, we took a call for help every 4 minutes across Queensland. So demand for services had been on an increase prior to the pandemic, and the complexities associated with supporting women, children and families have only amplified since coming into a challenging environment we're now all operating within. I think it's important to highlight that at the height of Queensland's first lockdown, it happened just a matter of weeks after the heinous and very public murder of Hannah Clark and her children. So while every death due to domestic and family violence is absolutely significant, the impact of Baxter's actions were felt right across Australia, seeing incredible call surges to every service in the nation. So while our numbers did not sharply increase due to COVID initially, they were already at some of the highest numbers DV Connect have been experiencing in nearly 20 years. So we saw a 32% increase of our calls to Men's Line and a 33% increase of police referrals. So that's at attendance at a domestic violence incident in the weeks after and in the beginning of the pandemic. During COVID, we saw a marked increase in the complex nature of the calls that we were receiving, the severity of the violence that was being experienced, and an influx of calls from women who had never contacted a service before, particularly single women. Some of the most significant challenges we faced during this time was immediate changes to the way that domestic family violence and sexual assault services needed to be provided, and that was sector-wide. So calling a service for help while being in lockdown with an abuser was risky and in some cases impossible. So there was a sharp increase in email and web contact, and this was particularly challenging for services who were predominantly face-to-face. At DV Connect, 2/3 of my crisis team did the unimaginable and started working from home within 1 week of the pandemic. Due to this, what I call profound selflessness, our service did not skip a beat. We quickly learnt how vital the tourism industry is for access to safety. And when it shut down almost overnight, our ability to source safe accommodation and access public transport was hands down one of the greatest challenges that we faced. A number of high-risk remote communities were completely restricted in or out, which made emergency evacuations extremely complex to negotiate during that time. Refuges across the state went into either total lockdown or a significant restriction on the volumes of families that could be accommodated. And mainly this was just because they haven't been designed for that kind of social distancing. Border closures. Now, this was particularly tricky, not only to get women in and out to safety, but it was also being used as a tactic of violence. So there were instances of men deliberately taking women over the border to be forced into mandatory isolation with them. We worked quickly with police who were managing border access and control at this time to change their screening and their safety protocols. There was either an immediate reduction or in some cases complete ceasing of men's behaviour change and support programs and counselling programs, because almost all of them were provided face-to-face. So that was really tricky, particularly from our men's line perspective, where we rely on that throughput referral. And I guess one of the most concerning was that there was a police reluctance to take offenders into custody for breaches of orders or to issue ousting orders during COVID. It was quite common that reluctance was there. So while this time has been challenging, there's also, I just want to say that there's also been some silver linings as well. That, you know, really we've been forced as individuals, organisations, networks and governments to really think outside the box, to be agile, to be creative, and to find alternatives to problems that we may not have otherwise either had the willingness, the resources or the support to take. We've taken collaboration with problem sharing and solving to a whole new level, particularly cross-sector and with the way that we work with government. During this time, the sector's received a critical injection of flexible funding, which supported in particular the technology required to get people working from home. Some of this funding, we're pleased to see, is being continued by state and federal governments over the next 4 years. We don't know exactly how and what that will look like yet, but there's promises have been made. There's been really important changes to court processes, like for instance, virtual court appearances, changes to the Residential Tenancy Act, and online reporting to police has been implemented during this time, and many of which, particularly the virtual court appearances that we were told would never happen. So there have been the Commonwealth supports, such as emergency payments, medical for women and children on temporary visas, were previously not eligible to receive it during this time, got access to a number of benefits and support systems they couldn't. Services that traditionally provided face-to-face only are now and continue to be making those programs available online. And I guess most importantly, the sustained media coverage and awareness of this scourge throughout Australia has supported a national recognition of the actual scale of this problem, particularly acknowledging the escalation, complexity and severity of domestic, family and sexual violence in times of natural disaster. So, so that's been really important in terms of continuing for this to be a dominant national conversation and a national collaboration, particularly with the review of the National Plan to Reduce Violence Against Women coming up in July. Thanks.
Thank you very much, Beck. So I've even after absorbing so many of you, given the month of May and the effort across the board to increase awareness around this topic, just your speaking then, there was quite a few things I hadn't even thought of as being challenges for the sector and for people experiencing violence. So thank you for that. I know there's so much that could be said in this hour, and I have to acknowledge that we're really just looking at the tip of the iceberg here today, but some really insightful comments there. Thanks, Beck. I'm going to move on to our next speaker, Cecilia. Cecilia Barassi-Rubio is the Director of the Immigrant Women's Support Service, a specialist domestic violence and sexual assault support service for migrant and refugee women. Cecilia has been the IWSS's director for 11 years, and she has extensive experience working in government and non-government roles. She's a migrant from Chile, a feminist, and her practice is driven by compassion and a commitment to social justice and human rights. Cecilia, what perspective can you provide on the both the experience of cultural and linguistically diverse families experience violence and the service provision that your organisation has been able to provide during the pandemic?
Thanks, Stacey, and thanks to QCOS for the invite. And I also acknowledge the traditional owners of the land in which we live and work. Beck mentioned a lot of issues that are really common across everybody in the community. So I'm not going to repeat a lot of the information that she has provided. But I think we must acknowledge that due to COVID, life for a lot of people around were turned around upside down. And whilst we were all in the same situation, we were all experiencing COVID-19 in terms of being in a global pandemic, the personal circumstances dictated how we experience and continue to experience the ongoing impact of the pandemic. So what COVID-19 did was to highlight disadvantage, poverty, racism, and many other social issues that exist in our society and remain unaddressed. We knew about them, but I guess we became more acutely aware of them because of the pandemic. However, it also presented, as Beck said, opportunities for collaboration never seen before, and showed us that systemic change is possible when there is political will. I'll provide some insights into how women experience, women who come to our service, who receive support for domestic violence or sexual violence from IWES. And this is in terms of the challenges that they experience, and they had to do with, having, there was no information at the beginning in different languages, so it took some time for that to become available. So all of us who speak English didn't know what was happening. We didn't have a lot of information. So imagine for someone who doesn't speak a lot of English, not knowing that there's not information being made available, that was quite challenging. Loss of employment was a big issue. A lot of our clients rely on casual employment in the sectors of hospitality, massage, deliveries, food deliveries. So all those jobs became redundant, or at least they were stopped for a big part of the pandemic. So what we tried to do, because we knew what was happening, and for us it is 15 months, because we became our work with plans and things like that from March. We didn't start from before because there was no formal announcement made by the government. So what we did was to make sure that all clients received some gift vouchers so they could purchase food, because we saw that people were hoarding. You went to the supermarket, there was not much available, and we knew that women didn't have money. Therefore, at least having a gift voucher would have helped them to go to a supermarket and at least source some basic items for them and their families. We're lucky that we received funding from the Department of Social Services for emergency relief, and we received additional funding for that. So that was helpful. And also the additional funding received by our state government was also allocated for emergency relief. So overall, we didn't experience an increase in demand, and this is a difference with other services, but we did experience, or the women experienced, an increase in frequency and severity of the violence, and they had more challenges and difficulties in terms of making contact with the service because of the high levels of monitoring of the perpetrators. So the intersections with loss of reduction of employment, the challenges related to schooling children at home, although, it wasn't meant to be homeschooling, but it was, because the parents had to learn how to teach the children. They had to learn how to work with laptops. A lot of families didn't have laptops, didn't have printers, and they had to print some of the resources. So that was quite frustrating. And also for the children who didn't know about learning online, that was a challenge for them as well. So we had to create, we were lucky that the Minister for Child Safety, Youth and Women, the Minister that I found at the time, she called weekly meetings, and Beck and all others also were part of these weekly meetings where we had opportunities to provide the minister with up-to-date information of what was happening, what was the impact for women. And she was really finding solutions. She was talking to other counterparts within the state. And then, some of it extended to other federal government, and some of the changes that Beck mentioned came about as a result of those meetings and us providing that information to the minister. And the public servants did a really great job in really moving things fairly quickly. So there was a lot of confusion. People became confused when they came back from overseas, and suddenly they were told that they had to quarantine in a hotel. They didn't understand. So we got lots of clients who were distressed, who were in that situation. We also, the women also, I say we, but this is the women who experience issues with informal tenancies, because our clients don't have the resources to participate in the private rental market. So informal tenancies are very common, but there's not a lot of protection for people in this type of tenancy. So they lost their tenancy, some people because the landlords would say, no, because you have to go to work, and I'm concerned that I might get COVID because you use public transport, for instance. So the issue of hoarding had an impact on health. For instance, a lot of people couldn't access Ventolin. So, that was an issue that we had to deal with. So some things were really specific and might look small in the scheme of things, but they were extremely important at the time for the people who were experiencing it. In terms of I can tell you lots more things, but I know that we're really pressed for time. So in terms of the team experience, we started our processes in March. On one of the weekends, I realized that the situation was becoming serious, and there was some more news coming up from government. So I devised an impromptu COVID response, which was presented to the team first, discussed with the team, then with the management committee. And some of the decisions that we had to make were moving to our IT system to the cloud, which wasn't the case before. I was asking the management committee to consider a directive to tell people not to come up to work when they were feeling unwell. That's a change of culture, because we turn up to work with the sniffles, feeling a little bit unwell. That was a big shift that we all had to adapt. We also came up with an idea of what do we do if people become unwell with COVID. So we came up with a policy that allowed 2 weeks, and that obviously needs to be reviewed as well. We try to we develop a hybrid model of skeleton staff in the office and others working from home, so we reduce the likelihood of infection. That meant a huge change for all of us, because for some it was quite difficult to adapt to what is this business of working from home. I'm used to be working from the office. So we had to purchase the equipment and make sure that people were working safely. We had to define a workspace. What does it look like for someone working from home? What's a workspace? Are you supposed to have a spare office, or is that a space where you can work safely, and you might have another space where you can work in terms of, if you're working with clients, maintain confidentiality and privacy. So we, had to redefine a lot of things. We kept the staff needs at the forefront, in the same way as we kept the needs of clients, because we are a multicultural workforce. So all of us have family overseas, and all of us were experiencing different levels of distress relating to knowing what was happening overseas. Some of us, lost family and friends and had to grieve in a way that in the past we would have traveled overseas. Now we had to just, try to make do with being in Australia, being in Queensland quite safe, but knowing that our families and friends were doing really well. So we also had to make sure that we had consideration of people who use public transport, and also who live with people who were elderly relatives. a lot of documentation and information with the team. So we started meeting on a weekly basis to break down isolation and to make sure that there was a sense of cohesiveness and that people didn't feel that they were on their own. So there were lots of late nights for me and for the management committee in trying to work these new systems. But by June 2020, we had a business continuity plan. We have a staged return plan to on-site work. We also have a risk assessment template, and we had a COVID register in which I would keep records of people who had to be tested or people who had a family member who had to be tested. So, to make sure that we protect others, because the main issue that I think we have all experienced is fear and not knowing, fear and uncertainty, which bring us to the issues that the women experience. Women who experience violence experience fear and they experience uncertainty. That's why it's so difficult to make decisions. So, how we're traveling now, management committee extremely important. Support and trust from the team that I was given the right advice and direction, and that the management committee was supportive. So quickly, I'll tell you in 1 second, we're traveling really well. We have welcomed 3 new babies and 1 due next week. So yay, that's good news for the team. We continue developing expertise in terms of working remotely. We have discovered that working remotely is conducive to work-life balance. So that's part of our enterprise bargaining with the management committee. And we also acknowledge the support from our funders and our donors and colleagues from government and non-government, because we truly work together and we work so effectively, and we manage to overcome so many issues together, and that must be commended, and I'll never stop acknowledging that.
Thank you so much, Cecilia. Great insights again. And you've really touched on the challenge to pivoting towards that online or tech mediated service delivery that, services who are dealing with any kind of crisis level support had to do so quickly, and really, for the most part, have done so well, given all of the constraints around them. And that's a fantastic segue to the perspective that Catherine will be providing, because Catherine Rendell, our next speaker, works for is the project lead for DFE Workaware, and Catherine will, I'm sure, say a little bit about her work. But Catherine, DFE Workaware is a program of Basic Rights Queensland, and Catherine has worked with family and community services for over 40 years, beginning her career working alongside young children arriving as refugees from Vietnam, Cambodia and Laos, and then in women's refuges. She was the founding academic in the Child and Family Studies courses at Griffith University, and I can attest to the value of that course because I've studied it myself, and most recently established the DFE service for families from culturally and linguistically diverse backgrounds in Logan. She continues to be a committed advocate for women's and children's safety, including in the family law system, and has published several related articles. And the work that Catherine's been doing recently really speaks to that organisational response to domestic and family violence. And I'm sure Catherine has quite a lot to share on that topic. So I'm going to let her say her bit. Thank you, Catherine.
Thanks very much, Stacey. And I would like to start by respectfully acknowledging that I'm coming to you from Turrbal and Yagara country here, and show my respect for elders past, present, and the emerging leaders who we are lucky enough to meet here from time to time. I'm actually going to start off by just reminding us that domestic and family violence is a workplace issue. That's been highlighted by both Beck and Cecilia. And I just also want to start by saying I've just a minute really before I came on, I had a call from my daughter who's a single mum in Melbourne. and has been homeschooling 3 children and trying to work herself. And I was trying to get a word in to say, I have to go. And she was offloading so much I had trouble getting in. So there's all sorts of ways in which people are experiencing stress currently, trying to be workers in a different environment. To centralise this discussion around domestic and family violence, I think I'd start by saying that we understand that about 62% of women who are experiencing domestic and family violence in Australia are employed. And we don't always have that picture in front of us when we're thinking about the experiences of people. So we have, I think, nearly 2/3 of women experiencing DFE are actually in the workforce. And so we also know that workers report, and about 1/5 of workers report that domestic and family violence impacting on their workplace. So we must also then picture that when that workplace is at home, that it would increase substantially. So we know that people experiencing directly domestic and family violence are amongst us. They're amongst us in community services as well as in other workplaces. We do know that not much has been researched around the experiences of the domestic and family violence for the community services sector. And my colleague, who I think might be online, has been, seeking to remedy that at some level. So we're hoping to know a lot more about the experiences of people in our sector and how they're managing, to stay safe. We also know that people using violence are amongst us. So while they're in workplaces, we know there are people experiencing domestic and family violence. We must understand logically that there are also people using violence, hopefully not as much in the DV sector, but certainly in across many workplaces. And one study that was done in 2017 showed that a number of the men involved in men's behavioural program disclosed that they use violence during working hours. So they use controlling tactics and direct violence during workplaces and during working hours and in workplaces. So what we know about workplaces is they can be a great place to be someone else. They're a safe haven often from the experiences at home. You have a different identity in your workplace often. But it can be somewhere where we can, just have a break, if you like, from what's happening at home. But it's also a place to be discoverable in the language of online security. So we know that we can be found in a workplace. So when we're working from home, I guess workers are both invisible and visible. So they're visible at some level to somebody, and they're invisible in a public space too. So that can cause both safety issues, but also protective opportunities. One point really to make at this point is that employers are responsible for the safety of workers wherever that workplace is. So there's case law around that, and we know that it's important for all of us to understand we have to keep our workers safe wherever we are. We can safely guess that not all people experiencing domestic and family violence are engaged with specialist services like Bex and like Cecilia's, that in fact many people don't access specialist services, and therefore let's see workplaces as an opportunity to further develop people's opportunities to be protected, but to move out of really dangerous situations. So it becomes, in that case, a very important place to develop appropriate and safe responses to domestic and family violence. And one way to do that is to make sure everyone in the workplace has a good understanding of what their rights and responsibilities are. So policies and procedures offer an opportunity to put into practice those things that we think are really important for the safety of workers. So we know that if a workplace has really good and appropriate and safe policies for workers, that they will, in fact, need to communicate those clearly to their workforce as well. So it's not enough simply to have good policies in place. If people know about them, then we are establishing a good protective factor for people. If people know they'll be supported in a workplace if they're experiencing domestic and family violence, then they're more likely to seek assistance when they know that they're unsafe. And as we all know, women experiencing domestic violence are the great experts in terms of their safety. So, so when this crossover of home and workplace occurs, we really need to think clearly about what we have in place as workplaces, knowing that we're responsible as employers for the safety of our employees. So we in Domestic and Family Violence Work Aware Service do have a lot of information that can be helpful around developing appropriate policies and procedures. And I guess finally, I suppose what we want is we want everybody to be prepared for situations of domestic and family violence as they occur. So we don't want the first time to be, when you think about domestic and family violence in your workplace, to be when it occurs. We want everyone to be ready for that and everyone to have an understanding of what's available to them and to know what's the next step if something is occurring. So in that spirit, you know, I'm looking forward to further discussion with my colleagues.
Thanks very much, Catherine. Again, lots to think about, and this is really an emerging field, isn't it, where we're finding out more about how workplaces can form a good response to both supporting those who are experiencing domestic and family violence and also those people who are using violence, who, as you say, are working with us, amongst us in our workplaces. I'm keeping an eye on the chat and the question and answer. So if anyone does have any questions, please feel free to pop it into that chat function or the Q&A function. But while we're waiting for people to form their questions, unless they've just been dazzled by so much great information, I'm going to go to you again, Beck, and pose this question to you around your, as a leader in such a prominent organisation, a service in the sector, across this time that we have been dealing with the pandemic, what has been your most significant learnings?
Oh, not that I needed to learn this, but just first off, I've got to say, being incredibly overwhelmed by the team of people who did everything in their power, and I'm meaning my team, to ensure that our service remained available 24/7, 7 days a week throughout all of that, even when they themselves were living through stress and uncertainty, a lot like what Cecilia had talked about, particularly, you know, so many of them had family overseas. There were babies born they've never met. There were funerals they couldn't attend. There was all of that sort of support. So I want to take this opportunity to just say how much I admire everything they did to keep us working. But really, they're also fatigued. The sector is fatigued and the demand remains. So the learning out of this is how we maintain this kind of momentum and demand in terms of the way that the team need to work through all of that. I learned that there's still significant investment is required for more online access to services, that we've done what we've done and pivoted really quickly. But now that we see the value of a lot of that, but also to unpack if there's any unintended consequences to that mode of service delivery. So there needs to be more work in that area. I've learned that the temporary changes to the laws and the government systems that I referenced, actually we need to unpack their permanency, because a lot of them are just sunset legislation. That continues to be the most significant barrier to women and children's safety is safe and affordable housing. And COVID really amplified that, you know, emergency access to emergency housing, transitional and long term, really was amplified during COVID. That women's ability to access and sustain independence increased substantially during, particularly those that were accessing Centrelink payments, where their actual living allowance was raised to what it needed to be. And we found a lot of women could actually access their own accommodation or their own independence, and having that reduced back down. That has actually been a really big stressor, particularly because a number of women access that safety, but whether or not they're in a position to maintain that. And we've seen quite a lot of some really difficult and complex situations for women, and they're kind of forced into a situation of, is it homelessness, or do I return to my abuser? And that's kind of the option many of them feel that they've only got. And I think also, the economic stimulus post-COVID is disproportionately focused on male-dominated industries, particularly with women being so largely impacted, and their abilities or options for recovery and independence. So I think we also need to demand a gendered lens on the future state and federal budgets, because the impacts of COVID are still existing, but even those to date are far from over and far from sorted, and we need to make sure that women's opportunity for recovery and independence and is equitable. They would be my learnings.
All eyes on the state budget this week, Beck. We'll see what might come out. That you mentioned a few kind of intersecting things like social housing and other economic stimulus. So we'll be watching very carefully to see what happens there. Thanks, Beck. Cecilia, what would your takeaway learnings from this period be? And I know we've got some questions, so I'll go to Cecilia and Catherine, then we can have a look at the questions that are in the chat function.
For us, or for me, in terms of my own reflection, is I feel that we learned to pause, because we're always fairly reactive, and we try to deal with change. We all went through a change process. Processes are difficult, are challenging, but we all had to adapt very quickly. But I also learned that when we were able to pause, reflect, replenish, because we had to re-energize the team, because for me it's not just about, okay, we all work from home and it's all good. This is about how do we work from home and we maintain the focus on women. Okay, we're working from home. That's our response for us as a team, as employees. So now that we are settled and we have learned how to do this, and we are being supported and resourced, very well resourced, how do we maintain the focus on the women and their needs? Because things change, and remember that we had several lockdowns in between, and people also had traveled overseas, and people had traveled interstate, so that brought other issues for them. Upholding people's human rights, that was crucial, and I think that is so essential in anything we do. Short-term responses are important, but I think we need to consider that a short-term response might be something that looks good, but it doesn't necessarily going to have a long-term impact on people, and it's not going to reduce poverty long-term. It's not going to reduce the housing crisis that we're experiencing in Australia. So it's about innovation, but the innovation that is really going to respond to the needs of people. Communication, we have all spoken about this before, with government, with non-government, working together, helping each other. When I said that this level of working together and collaboration was unprecedented, I do think that in the 90s, Catherine, you might remember that in the 90s, we used to work really alongside, non-NGOs and government officers. We used to work together a lot. So we used to develop responses together that were meaningful to the community. There was a lot of community development that came about from those relationships. And yes, things have changed, but I think we need to go back to basics as well. Too much bureaucracy. I realized that, you need something. And, when we mentioned some of the things that have changed, dealing with courts online, that was, who would have said that, think that we could do that now? It wasn't impossible. but it was made possible because we were able to highlight the issues, and everybody, because we all experienced COVID. It was a global pandemic. The judge, the police officer, the support worker, all of us experiencing. So I guess that made it a little bit easier for people to understand how difficult it was for people to, to go to a court or feeling concerned about, going to a court and using public transport and all of that. I felt that our skills were tested over and over, but we remained resilient. And that was extremely important to maintain the resilience within the team. And also learning from others in terms of, there wasn't a lot of templates, okay? But, it was about learning and trying to access information from several sources, and then come up with something that would work for the specific team and for the specific group that we are providing services to. I don't believe that we have done it perfectly. I'm always open, and I wish, anyone who's got feedback about how we managed throughout this time, please feel free to flick me an email and let me know if something that you think that should have worked better, didn't. Please let me know, because I think it's important that we improve. We need to learn from this. This is not going to change. And my next concern is that once they open the borders, I think a lot of us are going to go overseas. So we need to think about backfill, which is another issue for services like ours. How do we backfill specialist services? I'm not going to stop people from going to visit their families. So that's another learning and another, I guess, unknown.
Really good food for thought. Yeah, we have to think about that, don't we? As far as the workforce goes, how we manage the ebbs and flows of the demands on the workforce, including how we deal with a fatigued workforce. Yeah. Thanks, Cecilia. Catherine, significant learnings for you over this period?
I think that, one of the things that might help answer the question that's been raised as well is that the importance of integrated systems. So we talk about that, and I certainly was part of one of the early ones in Logan for domestic and family violence. But, integration with all of us as well, so that we make sure that the links are made with specialist services as well from workplaces. So we've certainly been engaging in that, but I think that's just so important, because we know people aren't getting, sometimes the most vulnerable people are the people who are most unlikely to get to the specialist services. So whichever link can be made to get people to access the resources they need, then, we need to work on that and build on that. So I think the work, where we're educating workplaces and that everyone knows that, we blithely say everyone's responsible for the safety of the community, but, we can actually do that in workplaces. We can actually ensure that people are knowledgeable and understand both what they shouldn't be doing as well as what they should be doing. So we're not expecting people to take full responsibility for their colleagues' safety, but considering colleagues are one of the first ports of call for people, that's really important. I was interested in, I think it was Cecilia or Beck, sorry, I can't remember who mentioned about an agile workforce and looking at alternatives. And I was thinking in a systems level too, some of the larger organisations we encounter have some pretty good resources in place for their workforce around domestic and family violence. So we have met large corporations who have accommodation available for their workforce, for example. So thinking maybe a little bit laterally about how those connections could be made, and I guess speaking to Cecilia's memory of the cross-sector collaborations that occurred before, and I know that DV Connect have been building on those substantially also. So I guess my point, I guess, is the importance of integrated systems, not just as an idea, but that we actually do that, and that we actually think laterally that those systems are in place across all sectors. So for the question that was posed about how people outside the domestic and family violence sector can be advocates. I think any workplace, any person in any workplace can be a really strong advocate for the safety and ongoing health of their workplace.
Well said. Thanks, Catherine. We do have two questions that have come up in the question and answer function. Now, Cecilia had mentioned a really resilient team and workforce, and Beck had also mentioned that resilient and workforce that did really well during the pandemic, adapting their service delivery, is also fatigued. And the demand has remained. That demand for services hasn't petered out at all. So how can the silver linings from the COVID be maintained for the long term? How can we harness some of the good things about our service adaptation to kind of, I guess, relieve the workforce somewhat of the pressure on them?
I might jump in here, and it's more broadly than just the workforce as well. But Cecilia had made a mention of the weekly gatherings that a core group of service providers had met with the minister regularly, and I can't sort of underline enough how important that was in terms of, so every week we would come together and we'd say, because it was so rapidly unfolding in terms of we were adapting and changing, but then we would go, okay, is there an issue here? Or there were other things that were coming up, and it was cross sector. So it was police, it was ambulances, it was the social workers in emergency departments, it was child protection. It was a whole lot of things that we were feeding in, and how our intersections of support needed to sort of be addressed so rapidly. But the fact that we also had, you know, the DG was there and the minister was there, and we would just go, all right, these are the issues for this week that needed to be addressed. They would go away, and then they would, there was this rapid response. So I guess one of the things is how, in terms of silver lining and how these things can be institutionalized and maintained, is that how do we actually maintain that level of connection to those who actually make those decisions? How do, now that we're out of that immediate sort of danger time, we actually do need to capitalize on the way we work together during that, because we moved mountains and things that probably would have taken a decade, if ever. So things like, how do we actually keep women being able to access courts, for instance? But I know that there was a magistrate who had actually spoken to a woman over 5 times throughout the day for 2 minutes at a time while she was in the toilet in her home, making, helping with that intervention. Like the way that we worked outside the box. So for me, it's about really focusing on how do we capitalize on all the collaboration that we did. How do we keep doing that? How do we keep, because even though the immediacy of COVID has gone, we're on the cusp of it, particularly when we open our borders again, to what that might look like. So I think it's how do we keep that momentum going?
Yeah, thanks, Beck. Cecilia or Catherine, do you have any other comments about maintaining any of the silver linings long term?
I agree with Beck, and I did say at the beginning that political will is very important. Through this experience, we know that we can deal with systemic issues, because, you know, the issues that we as service providers experience, the women experience the violence, we experience the systemic issues with them. So we could see that it was possible, and within very short time frames. Beck said a week, and sometimes it was days. You know, we would raise the issues, 2 days later we would get an email telling us this is the solution for this, and this is the way that this is going to be done now. So it shows that there's no need to make things too difficult. These issues we have all we're all aware of these issues, and I think at the end of the day, the issue is the pandemic. Next, in a few months, it could be like in Victoria now, they're dealing with heavy rain and other issues as well, and a natural disaster. So it's going to be a natural disaster. It's going to be something. So we need to, what we have learned from COVID, what we have learned, okay? We all know how we have done it without a manual. That shows that as service providers, we're highly skilled, and we did, we made sure that we didn't disrupt service delivery, because that was crucial for us not to disrupt service delivery whilst we were looking after staff as well and our clients. We present a risk to the clients and they represent a risk to us with COVID. So it's mutual, you know, we're a risk to them. And sometimes I think we're more of a risk to them than them to us, because, you know, sometimes our clients, they don't get the same nutritional nutrition that we do. So I think that the learnings need to be gathered somewhere. Yes, do some research if you want, but don't spend the next 10 years doing research on how we responded, because we have done it. We know how to do it, we can tell you, and then we can implement, we can change, we can adapt.
Yeah, look, I think I agree. That's a really neat point, I reckon, Cecilia. In answer to that question, draw on what's known, draw on the strengths of what's occurred and build on that, and definitely you know, recognize the wisdom that's in the sector and how they've done that. And I just, my one extra point, I suppose, from the workforce point of view is, you know, I think we're looking at workers differently, and I think that's a good thing, and that will continue.
Thanks, Catherine. Thank you, Cecilia. Thank you, Beck. Wonderful responses from all three of you. I have learned quite a bit in the last hour. I hope those who are on the line have too. I wanted to quickly mention the Human Rights in Action upcoming event, because it is actually on the topic of coercive control. So we're looking at that and using the Human Rights Act as the lens through which we're focusing on that topic. Some of you might be interested in that. If you've come along today, you have an interest in the area, we have just popped that link in the registration, in the chat box, so check that out if you would like to. I'd like to really give my genuine thanks to Beck, Cecilia and Catherine for your time today. Not only your time, but your generosity in sharing your wisdom with us for all of our benefits. So thank you very much, appreciate it. We're going to be sending out a post-event email to all participants, and the websites, the organisational websites for all of our three speakers will be included in that email if you're interested in following up on any of their work and all the wonderful work that they're doing. So I think that is all from me. Thank you again. Thank you for coming along. Follow-up information will be that email, so please have a look out for it. And thank you again, Beck, Cecilia and Catherine.
My pleasure.